Thank you so very much, Angela. Good morning, everyone. As we continue to navigate this pandemic, we are starting to see encouraging indications in our key metrics that we are moving past the holiday surge. Our case rate has come down from nearly 49 cases per 100,000 on January 11th to 31 cases per 100,000 as of yesterday. Our positivity rate has also declined for 10 out of the last 14 days and is now at 5.66%. And while these numbers are encouraging, they are also a reminder that we must continue to practice the mitigation measures that work. In conjunction with continued mask wearing, hand washing, physical distancing, we are working on a historic vaccination effort to help end this pandemic. As we all know, we are facing a very limited supply of vaccine from the federal and state governments. Right now, per the governor's directives, we are still prioritizing all of phase 1A and 1B. For the more than 55,000 people who are currently eligible to receive the vaccine in phases 1A and 1B, we have received approximately 15,000 doses since our first 100 doses on December 23rd. Again, for the 55,000 people, we've received approximately 15,000 doses. And while some parts of the state have moved on to phase 1C, we are still working to prioritize our first two phases based upon the supply we have received to date. We're hopeful for an increased supply soon, and we will provide appointments as soon as we are able. Right now, we need people who want to receive a vaccine to pre-register if you haven't already. Pre-registration is now open for all groups in phase 1B, including our adults 75 and older, K through 12 educators and staff and child care providers who are not part of the school system, and adults with developmental disabilities, and for adults 65 to 74 in phase 1C. And we have a poster board. You can pre-register online at vaccine.howardcountymd.gov. Again, that's vaccine.howardcountymd.gov. If you do not have a computer, you may call 410-313-6284. Again, that's 410-313-6284. And please provide your contact information so that you can be contacted when appointments are available for your group. In phase 1B, we have already pre-registered more than 20,000 of our residents who are age 75 and older, more than 2,000 of our residents who are non-public school employees or child care providers, and more than 300 developmentally disabled adults. We've also worked with our public school system, who has identified nearly 10,000 school system employees who are eligible to be vaccinated. But it's critical to remember that with only a few thousand doses per week, not everyone will get an appointment immediately. And per the governor's direction, we've been instructed to prioritize our older residents in phase 1B first. However, we're also making significant progress laying the groundwork to ensure speedy vaccination for our educators, both private and public, as well as our child care provider staff. Just yesterday, we began vaccinating this critical group, and I want to thank Dr. Martirano and the Board of Education for providing that prioritization of school system employees so that we can work together to fold in as many school system employees as supply allows in vaccination clinics moving forward. Let me be clear. I want our students, our educators, our staff members to be safely back in our school buildings as soon as possible. This week, as part of the school system prioritization of Group 1, school nurses are being vaccinated so that they can, in turn, begin vaccinating other school system staff next week. Next week, we will begin vaccination of school system prioritization Group 2. Moving forward, we're hopeful that as supply increases, we will be able to continue this progress to more quickly vaccinate our public and private school educators and our healthcare providers, as well as our older adults. We're also partnering with our school system to prepare vaccine operations at multiple sites, including the gym in which we are standing this morning. As soon as we have more vaccine supply, Marriott's Ridge, Longreach, Centennial, and Reservoir High Schools can be ready to operate within 48 hours. Additionally, we've allocated more than $300,000 in CARES Act funding to support the installation of MERV 13 air filters in all school facilities to help ensure that students and teachers have a safer learning environment to return to when they transition to hybrid learning. In preparation for accommodating Phase 1B, the Health Department requested 20,000 vaccines so that we can ramp up starting this week. However, yesterday, we received 4,500 vaccines. Yesterday, our new vaccination site at Howard Community College opened and administered more than 1,100 vaccines. Today through Sunday, they have an additional 4,000 vaccines already scheduled. And every week, our health department administers nearly 100% of the doses by the time we receive our next shipment. And I'd like to acknowledge and thank our incredible vaccination staff and team who have worked tirelessly to make these clinics run smoothly and effectively in a short period of time. As the governor stated earlier this week, we have prepared adequate infrastructure for increased supply of vaccine, so when we receive those doses, we will get shots in arms immediately. We have already ramped up our staffing, and I have also directed all of my departments to work with the health department to prepare for additional vaccine. We are all committed to assisting in this Herculean effort and this expansion of hours for our vaccine clinics. This week, to manage the many questions and concerns from our residents, we pulled folks from multiple departments and set up a call center. And we have already had nearly 2,000 calls over the past 2 days alone. And we know that there is some confusion and a lot of questions based upon what people are hearing from the federal, state, and local governments. To inform our community, we're also hosting a vaccine telephone town hall on February 8th for all county residents to have an opportunity to ask us additional questions and to learn more about this process. Again, that's February 8th for our teletown hall. This is an all-hands-on-deck operation for this government, and we have resource at our disposal so that when we get supply from the federal and state government, we'll immediately get shots in arms. It's what we've done for the past 2 months, and we will continue to do that with vigilance. I want to emphasize that no vaccine will go to waste in this county, and there is no vaccine just sitting on a shelf. We know that many of you are frustrated. I share your frustration. And while we are hopeful that production will increase over the next few weeks and months, we are still in a position where demand will continue to exceed supply for the foreseeable future. We know how many people are relying on a vaccine to just do their jobs as safely as possible, or to return back to normal life, to see their family or friends, or feel a little less isolated. And we're doing everything that we can to make this process go faster. We're working on the vaccination challenges we face today, but we're also looking ahead on the issues we'll have a week from now, a month from now, and throughout this year. This includes making sure we're focused on the equitable distribution of the vaccine, especially in our populations that may not have the same access as others. Whether the hurdle is having reliable transportation, or access to a computer or internet to schedule appointments, or that you've been traditionally on the outskirts of our medical systems, we will continue working tirelessly to ensure that you receive the vaccine that you need and that you are not an afterthought. We're working closely with our Department of Community Resources and Services, which already has the infrastructure at the ready from last year's successful census count to reach out and connect with all of our communities and make sure you're informed and ready to receive the vaccine when our supply is available. This vaccine is a lifeline for so many people who have struggled this past year, and we're working to make this process as smooth as possible. We continue to ask for your patience and understanding. At the end of the day, we can only administer as much vaccine as we have. And right now, we do not have enough vaccine for our eligible residents. This is going to take time, but rest assured, as soon as we receive the vaccine, we will administer it effectively and efficiently. Thank you.
Thank you, County Executive Ball. And now we'll hear from our Health Officer, Dr. Maura Rossman.
Thank you, County Executive, and thank you, Angela. The Health Department stood up its second clinic location at Howard Community College, where we were able to vaccinate over 1,000 people yesterday with their first dose. We have also begun providing dose 2 to those vaccinated 28 days ago when we first received our first shipment of the Moderna vaccine. It's amazing to think that it's only been 28 days. We will vaccinate twice that number on Saturday on what we're calling our Super Senior Saturday. This week, we received 4,500 doses split between two of the authorized vaccines, the Moderna and Pfizer. We have transitioned into phase 1B and begun vaccinating our seniors 75 and older, child care workers, and pre-K to 12 educators and adults with developmental disabilities. With enough vaccine and an all-hands-on-deck approach, we can vaccinate 20,000 per day. But our vaccine allotment has not been close to that amount, as the county executive discussed. Unfortunately, we do not know when we will get the amount of vaccine that we need to move into additional phases. We understand the frustration as it's palpable. I understand the anxiety among our residents who need vaccine and have not yet been able to get it. In preparation for vaccine distribution, we have pre-registration surveys available for healthcare providers, residents 75 and older, residents 65 to 74, private school educators, and those with developmental disabilities. We are also working with our public school partners who have established priority lists. We have started vaccinating the members of phase 1B, and with additional vaccine, we will move on to members of the other phases. We know that there are many questions about the entire process, from pre-registration through sign-up and ultimately vaccination. So that we can answer your questions, we have added more people to assist with answering the COVID information line so that you can speak to a real person Monday through Friday, 8 to 5. And I wish to thank our government partners who are making this possible to expand our operations. The health department would be unable to do everything that it is doing without the tremendous effort, support, and trust by our partners. We are streamlining our pre-registration process to include confirmation that surveys have been received, and are also working on a notification system that provides clinic information to not only email, but to phone lines as text. We have learned not everybody uses a smartphone. Using this new system, we hope to make information more easily accessible and comfortable for all. We are still asking that those who have older loved ones to help them with the vaccine registration system when the time comes. If you don't have the technology or need help, our partner agency, DCRS, is staffing the MAP line to assist with questions and registration. We have all of the pieces in place to be able to successfully vaccinate residents, but we're just waiting for vaccine. When that comes in the amounts we need, we will be able to quickly stand up clinics all over the county, just like the one we would open here at Marriott's Ridge. Thank you.
Thank you, Dr. Rossman. And now we'll hear from Dr. Shafiq Ahmed, Interim President of the Howard County General Hospital.
Thank you and good morning. Currently, our focus at the hospital is still taking care of our acute care COVID patients. We are fortunately seeing a slight decline in hospitalized patients. Overall volumes have been stable over the past few weeks, and we are managing well with that at this time. We do recognize that the COVID-19 vaccine are at the top of everyone's mind, and that many individuals are hoping to schedule a vaccine at Howard County General Hospital as a part of Johns Hopkins Medicine. We are currently following state guidelines and mandates for distribution of the vaccine allotment, and the expansion of those eligible may impact our use based on a limited supply, as was mentioned before. Our current vaccine supply is extremely small in comparison to the county and others. We are vaccinating a small number of patients and also our priority staff, which has been our focus from the start when vaccines were first released. We are receiving a lot of calls from the community, and although frustrating, unfortunately, we are unable to schedule patients for the vaccine appointments over the phone at this time. We are trying to keep our phone lines clear for people with urgent medical care needs. If you have been a Johns Hopkins patient recently and in the past few years and meet the criteria for the vaccine, you might be contacted by us in the coming weeks via phone or email based on the categories that were mentioned earlier. We are encouraging our patients and community members to continue to schedule through other state and local organizations such as the Howard County Health Department, as they are receiving larger allotments of the vaccine supply currently. All Johns Hopkins vaccines are by appointment only, and registration is done via Johns Hopkins MyChart, our electronic medical record. Our website, hcgh.org, is a good source for regular updates on this. And again, I continue to thank my partners, Dr. Calvin Ball and Dr. Maura Rossman, for their wonderful partnership as we are working as a team to ensure that we will get through this process. Thank you.
Thank you, Dr. Ahmed. Now we'll hear from Superintendent of Howard County Public Schools, Dr. Michael Martirano.
Good morning, everyone. I'd like to begin by thanking County Executive Ball and Dr. Rossman for their continued collaboration and support throughout the entire pandemic. I will keep my remarks brief. I welcome each of you to Marriott's Ridge High School, and I thank our principal, Tammy Goldeisen, who is here with me today, for arranging this event. Marriott's Ridge High School, which has been designated as a potential site for vaccination distribution when we are called upon by the Health Department. We are ready to go. We are pleased to be able to do our part to assist in the massed effort of caring for our entire community through this pandemic. I am so pleased that last week our school nurses and nursing assistants began receiving their first dose of vaccine. I look forward to the prospect of the county to continue to receive more vaccination doses so that our educators and staff can continue to be vaccinated as we return to in-person instruction. Throughout this process, I have worked very closely with Dr. Rossman, and our staffs have been communicating daily. The planning of the vaccine distribution to the Howard County Public School System staff continues to be a coordinated effort between the school system and health department that will continue in the days and weeks ahead. The Howard County Public School System developed a prioritized grouping of employees to receive the COVID-19 vaccine as we enter phase 1B. And we will continue to move into that group as we quickly, in the health, excuse me, geez. Now you all know my ringtone. A little bit of Italian in me, sorry about that. That's a little embarrassing. I'm so pleased by the work that has been done to each of our public schools in preparation for the return to staff and students. There have been efforts made at each school, office, and building to test systems and provide any necessary routine maintenance to ensure all HVAC systems were operating at peak efficiency. No building was left untouched. Some schools required new filters or other minor maintenance, but efforts were made at every building to test and maintain systems and maximize outdoor air filtration. In our school front offices and office spaces throughout the system, large panes of plexiglass were hung to create shields between workspaces when additional space isn't available. I have personally seen how effective these protective measures are, and there are several areas just outside my office that have had plexiglass installed. Additionally, the correct supply of personal protective equipment, or PPE, has been provided to all schools based upon guidelines provided by the CDC. Staff will receive 2 reusable masks and additional supplies that have been ordered to be able to provide masks to every staff every 8 weeks based upon manufacturer guidelines. Additional information related to the specific types of PPE that will be provided to staff upon their return to school buildings is provided on our website. I encourage the community to visit our website to view dozens of new FAQs that have been added in the past 24 hours and will continue to be added in the coming days and weeks. The site is accessible at help.hcpss.org. Again, let me thank our County Executive, Calvin Ball, for the additional $5.8 million in funding that has helped us secure the proper PPE, filters, Chromebooks, and other pandemic-related expenditures, and Dr. Rossman for your continued support and collaboration as we continue to navigate this unprecedented pandemic. Thank you very much.
Thank you, Dr. Martirano. And finally, we'll hear from Director Jackie Scott from the Department of Community Resources and Services.
Good morning, and thank you, Angela. I'd just like to take a moment to describe for you 3 specific areas highlighting what Dr. Ball and Dr. Rossman indicated DCRS is taking a all-hands approach on. First, we are staffing the phones alongside our health department partners to help those who need it with completing the online registrations. This also includes having bilingual staff available to assist those with limited English proficiency. We are also taking calls on our Maryland Access Point line at DCRS to assist additionally. And just as of yesterday, we received over 200 calls on that line alone, in addition to the numbers that you heard that we're fielding with the health department on the health department line. Second, we are providing on-site support at vaccine sites, including HCC, and soon this one and the others once they come on board. Our staff are on site to assist our older adults, those living with disabilities, and those medically fragile. We want to ensure that they are safely supported and monitored throughout their vaccine process from arrival on site to departure. Lastly, to ensure that we are reaching everyone, we are currently engaged in direct and targeted outreach to our 65-year and older population and are reaching out directly to our child care providers and early child care teachers. We are making sure that we are translating information in the languages that are needed so that we make sure all of those living in our community are able to utilize the information in a safe manner. We will be sending mailers, flyers, and posting signage also to inform the community. Our goal, in short, is to ensure that residents are informed and equipped with what they need to be able to efficiently manage this process, and that we are providing culturally relevant and proficient information. We want to make sure that we are reaching those in communities where registration disparities may be trending along racial and social economic lines. We are working hard to ensure that equity for all is in this process. Thank you.
Thank you, Director Scott. And now we'll take questions from the press.
Do you have an idea of how many educators, school staff have been vaccinated, and by March 1st, how many by then, when the hybrid return to school date?
Approximately how many educators have been vaccinated, and what is the projection by March 1st? We'll have Dr. Rossman answer.
I'll go first. Yesterday was the first day that we started opening up our vaccine to pre-K through 12 and childcare. I can't tell you how many of the group of the 1,000 or so people we vaccinated yesterday fit that. I don't have that data today. For Howard County Public Schools, and Dr. Martirano may want to chime in, we are establishing what we call a closed pod system so that we can vaccinate them per prioritization that the school system has decided. All of this is dependent upon vaccine. There are approximately 10,000 Howard County Public School staff who need to be vaccinated. That means 20,000 doses. I really hope we get that by March. We're planning for that, as you can see why we're here. I am trying to be cautiously optimistic, but I think this is just going to be a slow, patient process.
Just one more question. When you get the vaccine, are you reserving them for the second dose, or are they given out right away as the first dose?
Yeah, great question. That comes up a lot. So how it happens is how second doses come in. Second doses come in about 10 days to 2 weeks before a person's second dose, and it comes in with our initial shipment. So they go into the freezer or the refrigerator and wait until we vaccinate them. So for those data nerds who look at the chart, the second doses will look like they're sitting there because they are waiting for that person who got the dose either 21 or 28 days before.
Thank you.
Mm-hmm.
Thank you, Dr. Rossman.
Yes, I have a question. I'm sure Dr. Rossman and Dr. Ahmed may both be able to answer this. I'm curious, what's the ratio between divvying up the supply between the local health department and the hospital? And since Howard County General has about 1,800 employees, have you nearly finished vaccinating your entire staff? And then does the local health department then get that allotment from the state instead of the hospital? Can you explain how this is?
For the sake of Facebook, I'm going to repeat the question. This question is directed to the hospital and to the health department. Primarily, the question's about, what is the allocation to the Howard County General Hospital? How much are you through that allocation? And what is the relationship between vaccine between the hospital and the health department?
And are you almost finished vaccinating your entire staff?
And where are you on vaccinating your staff?
Great, thank you. That's a great question. Because this is Johns Hopkins Medicine Initiative, the allocations are given to the health system. And what I can say so far is, as published by the state, the health system has distributed approximately 64% of its vaccinations. And the others that are being held are for the second dose. And so the proportion of the proportion of employees across Johns Hopkins Medicine that have desired the shot and have asked for vaccinations, we are getting closer to 100% of them, certainly having received the first shot, but we are waiting for the second shot. No, the additional vaccinations have switched in the past week or two where we have gone to the other categories. So it is the 75 and up patients that are now being vaccinated out of whatever we're getting. So as we are still doing the second doses for the employees, those have been held from the beginning. We are shifting now towards whatever allocation is being given towards patients.
I'm really curious about how you guys get those patients. Are they coming from the county when they register on the county's website, or are there your patients who are calling the hospital and then you're getting those folks from that?
Those are specific patients that have had a connection with any Johns Hopkins Medicine site in the past few years. So if they had a lab draw, if they saw any site, any hospital, they are being reached out to because they have had a connection. So it's not specific just for the county.
And Dr. Med, since you're up here, what is the uptake at Howard County General among your, what you consider the frontline healthcare workers, among your staffers? What's the uptake percentage?
So I think it's hard for me to quote the Howard County General uptake because we look at it from a Johns Hopkins Medicine perspective. And as that number changes, I don't actually have that number for you, the full uptake out of the total proportion of employees.
Do you have the Johns Hopkins system, medical system percentage?
I don't.
For the folks that you guys are reaching out to, do they live in Howard County, or are they merely clients or patients from any facility with Johns Hopkins?
They can be patients from any facility, but because of our location, because we're a vaccination site, a large number of patients from Howard County end up coming to our Howard County General site.
And Dr. Med, you may not be able to answer this since you're the Johns Hopkins guy here. A couple of weeks ago, the governor said you can't sit on the doses, you have to use them, you can't reserve them for the second shots, but you said the Johns Hopkins system is in fact holding back the doses. How is that?
They are doses that are designated already, so it's not holding them back. These are people that are coming back and receiving their second shots.
I want to get an idea of how the registry works in the county. So say someone is in phase 1A or 1B, but they signed up on Monday when registration for 1C was already open. Is the county going through and sorting to see if there are folks in the earlier phases and then bumping them ahead of the 1C folks?
Let me have Dr. Ross answer that.
Again, I will repeat that question for the sake of those joining on Facebook. The question is, how does the registration work within the health department? There are those who have registered for 1A, 1B, 1C, and continue to register through 1A. What does that prioritization look like?
So right now, if you went to our website, you would see multiple surveys that are designated with a title. Phase 1A, healthcare workers, first responders, public safety. And you would click on that link, and if you are one of those categories and it has a description of what that category is, you would register. If you are 75 and older, there is a survey that says 75 and older and the definition of that, and you would register for that. When we get our vaccine, we determine what type of clinics at this point we would like. And there's factors for that. One is 2 different types of vaccine. We don't want to mix them at this point because they actually are 2 different doses and for safety reasons. The other consideration is when we have so many people in mass vax coming, we want to make sure, particularly for those that need accommodations, older adults and adults with disabilities, that we're able to accommodate their needs. So we receive vaccine Wednesday or Thursday on one of the graphics. We set about saying, okay, Thursday, Friday, Saturday, how do we want to divide up these doses, and which groups are we going to invite, quote unquote, to our private clinics. Clinics are all by appointment only. We go to our registration. All folks on the registration receive an email. We have a clinic open, come register, and at that point it really becomes first come, first serve. And that right now is how people are making appointments and coming to the clinic. I want to remind everyone too, is that please only schedule for a clinic when it is your, when you are eligible for that clinic, because unfortunately we do have some people either erroneously signing up for clinics because they're confused by the type of clinic, or perhaps thinking that they may be able to skip the line. We do ask for verification, and we will turn you away if you do not fit the eligibility criteria.
Dr. Rossman,
Yeah, so as an employer of Howard County Health Department, I cannot ask, the vaccine is not required. So I cannot ask my staff to tell me if they've chosen to be vaccinated. But I can tell you it's not 100%, which I would hope that every person who works for public health would believe in vaccine and be confident in that. But we know not everybody is, and there's work to do on that. I can tell you the statistics on nursing home, I have better data on that. And it varies. We have 6 nursing homes in Howard County. There are some where the staff, 75% have been vaccinated. Awesome. We have some nursing homes where 25% have been vaccinated. So to me, that just indicates, I think, what we suspected, that there are certain people who are not confident in vaccine, and we really need to do a better job of informing and providing the best information to everyone so everyone can make the best decision based on the information we have. Right now, we're in the period of great demand. I call that the early adopters. Don't have to convince anyone to get vaccine. People are just coming to us, and we can't do it fast enough. I worry about when that demand, when the vaccine, the supply, is more than the demand, because for all of us to be safe, we will need all of us to be vaccinated. So there's work to be done.
And can you explain, I know it was about 2 weeks ago, the governor said no one can just be sitting on this vaccine, and if you do, you'll be penalized. Apparently Hopkins is deciding to hold back, so they'll have second doses, but you clearly, the county isn't, because you've administered nearly 99%. So what, I thought it wasn't a choice. I thought you had to get every shot you had in somebody's arm.
Right, so there's nuances here, right? This chart is about our first doses. I did mention, I think in my remarks or a question, that we receive our second doses about 10 days to 2 weeks before that second dose is due for the patient who received the first dose. So in our refrigerator right now, I should remember the data, our second doses, we've distributed 10% of second doses. We just started 28 days ago. In our fridge, we probably have about 2,500 doses of second doses that cannot be used until next week and next week. So I'm making an assumption that that might be what Dr. Shafiq was describing.
If I may ask another question, please. So for the stores like Giant or the pharmacies, how are people getting into those? Are they signing up on the county's website, or do they have to contact those facilities independently?
Yes, so how it works is that in the state of Maryland, people can go to the Maryland website, MDH website, and you will see a link about vaccine, and you will see, I think it says retail pharmacy partners, and it says Giant. I've clicked on it. I know in Howard County there are 2 participating Giants. You then click on their website, and it's an online registration process. The last I checked was yesterday, and they were all booked. But that's how that process works.
We got to talk about schools. Does someone want to talk about schools?
Okay. What's the question regarding schools?
I would like to know, you guys mentioned that I think it was 10,000 staff members who need to be vaccinated. Where are you guys currently with that, and what happens if they don't get vaccinated?
Okay. The question is, where is Howard County on the approximately 10,000 educators and staff that need to be vaccinated? And I'm sorry, what's the second part?
And what happens if they
And what happens if they don't get vaccinated?
Well, good morning and afternoon once again. Let me frame it at a higher level. Howard County Public School System is the largest employer in Howard County. We have over 10,000 employees. 3 weeks ago, I surveyed all of our staff in terms of their interest and willingness to get the vaccine. We received a rate of about 7,800 individuals returned the survey. Of the 7,800, 88% of those employees said that they would be willing to get the vaccine. That is the highest in the state of Maryland. To date, we have implemented our priorities, our 4 priorities that we have as far as our groupings. Our first group are our nurses and our assistants. We have approximately 142 nurses and assistants, and to date, 107 of those individuals have been vaccinated. We still have other ones that we are still training so that they are prepared to provide the vaccinations to the individuals in our school system. Our hope is that we will continue to roll forward with the priorities once those vaccines are available. I've also sent out a communication to our staff this week preparing them how to sign up. As Dr. Rossman said, we are a closed pod, the school system, based upon the number of individuals. We are ready to go, aligning our sites, the 4 sites that Dr. Ball had acknowledged, bringing the vaccinations in, providing the opportunity for our nurses to provide that. Additionally, our Board of Education has determined that on March 1st, we will begin phasing back in for education in person. And I support that wholeheartedly. We want our children back in school, and we want our staff back in school, but we must do that safely. A prerequisite of that is not necessarily a return to school by every individual receiving a vaccine. We have to adhere to the CDC guidance that says that we must all wear masks, that we all must adhere to social distancing, we all must wash hands, and we must put all the other mitigating factors in place to prevent the spread. The school system is prepared to do that. We are 5 weeks away from that March 1st date. And it is my hope, as our metrics continue to go lower, which they have over the last several weeks, as we receive more daylight as we get closer to that date, warmer weather, hopefully we'll receive the vaccine at a more accelerated rate. We will have all those variables working together to create that herd immunity that we need, but also understand that we need to make certain that all the other factors that I talked about for social distancing, masking, washing hands are fully in place in addition to individuals receiving vaccines.
Can you accomplish that in 5 weeks?
Everything that I talked about can be accomplished, and we also recognize all the individuals here do not fully have the control over when the vaccine will arrive. I want to give our community confidence that we are ready to go. I'm giving the full force of all the resources in our school system to assist our community in the distribution of the vaccine. The 4 sites of which we've said are individuals who will provide the vaccines, which is critical. Many school districts are struggling with who can actually provide the immunizations. We're doing that with our nurses, and I'm very thankful and grateful. But right now, we are prepared with the PPE, all the training, and as we get our staff back, 5 weeks away. But I'm making that constant effort from the federal government to the state government. Howard County needs the vaccine, like every other district, and it is essential to get our children back in school, and we need to prioritize that. And we're ready to go.
Dr. Martin, forgive me, this was mentioned earlier, and I just didn't hear it. For example, Montgomery County the state has partnered with Hopkins through Suburban Hospital to provide, the state is providing vaccine doses for Montgomery County teachers. Is that going to happen, or is it happening here in Howard, or are the teachers getting doses that come from the Howard County Health Department?
Well, I'll let others speak to that, but it is my hope, as you talk to Dr. Rossman, representatives from the hospital, you've heard our county executive talk about it, that any available dose through any source that will help get vaccines quicker to our staff should be utilized. I'll turn that over to others who may want to talk specifically.
Essentially, the question is what other mechanisms might be available, and you gave the example for Montgomery County and their hospitals, so we'll bring up Dr. Ahmed regarding if there's other mechanisms available for educators.
So specifically to answer your question about Montgomery County, this past weekend the state requested Johns Hopkins Medicine to partner in administering vaccines in Montgomery County. A clinic was established on the campus of Johns Hopkins Applied Physics Lab adjacent to Montgomery County in order to make this happen. So this was a directive from the state for Johns Hopkins Medicine, not necessarily for Howard County General Hospital. And so any of the eligible residents there that they were directed to do, that is what is happening. And it is located in Howard County, but it was a desirable site that was chosen at the last minute because of a specific request from the state to distribute vaccines for Montgomery County. Hopkins Medicine is eager to help administer the vaccine, and wherever it can, working with its partners in state government in hopes of being able to continue to play that role across this region as well. And it's our hope that the APL site can continue to be a site, because it's a larger scale site than Howard County General Hospital, to give the vaccines as described.
So that's interesting. Thank you for that. Because the APL isn't adjacent to Montgomery, it's in Laurel, in Howard County. But the question is Howard County, is the state going to partner to help Howard County teachers get vaccinated as well? Is it in the works? Are you talking about that? Is it not under discussion? What's the status of other counties other than Montgomery?
Yeah, so I don't know where that discussion is right now. This is at the state level. It's a state directive that came out around Montgomery County. So I don't have the answer to that.
Fine, I'll ask another one. Looking at this, I mean, I have a ton of questions here. Looking at this middle one, you guys mentioned that you requested 20,000 doses on 119 and then got 4,500 and 127. Has that delivery ramped up since 127? Have you guys gotten, I know it's just yesterday, but is there any indication that you will be getting more?
So the question is there any indication that we will get an increased amount of vaccine? The current from previous week was a 20,000 requests from the health department, and what you heard Dr. Rossman say that there was 4,500 actually delivered. Is there an opportunity where there might be an increase to Howard County? Dr. Rossman?
Thank you. So we were aspirational in requesting 20,000 doses. I think as you've heard the governor report, the state of Maryland receives a little bit less than 75,000 for the entire state. So I would have loved to receive that 20,000, but we received 4,500, which represented a 50% increase from the week before. So we received 3,000 doses last week, 4,500 this week. We put in a request for double the amount that we received, 9,000 for next week. So I'm hopeful that that request will be fulfilled.
If you could speak to the, I think it was it 55,000 people who are just waiting, what would you tell them directly?
Oh, I feel for you. I feel for you. I wish I had vaccine to be able to vaccinate you and your family and everyone in Howard County. I understand the anxiety and the frustration, and this is a supply chain issue. And I think, I'm hoping from the federal government and the manufacturers, and hopefully with new vaccines being authorized, that the supply will begin to increase so that the health department can put vaccines into arms. That's what we want to do.
I do have one, I promised last question for me. Dr. Rossman, when I talked to you when you, first day of the first clinic,
I remember.
and you had talked about scaling up and what you'll need and getting vaccinators vaccinated, and we had discussed using high school gyms. Where are you in terms of the bodies that you need to get to, you're essentially going to have to work double time now, the second doses and first doses. Do you think they're available, the people that you need to staff these?
Thanks for bringing that up, because that does seem like a while ago, the first day at Ascend 1, and woohoo, look where we are now. And we knew that we would need to ramp up. We knew the first doses and the second doses. We knew we needed to add an additional within a month because of the second doses. So yesterday we started at HCC. Once we started an additional site, we know we need to keep adding sites. So this has been the plan all along, to continually ramp up. The health department has brought online or has hired additional about 25 vaccinators. We have all of Howard County government behind us, supporting us on sometimes a minute's notice that we need help. So we have the Medical Reserve Corps, and Howard County has one of the largest Medical Reserve Corps volunteer to help us. And if needed, we also can call up the National Guard. So I'm confident that as we continue to ramp up, we will be able to not only have the vaccine, that's one thing, right, but the staff to be able to carry out the operations of a mass vax clinic.
Thank you, Dr. Rossman, and to all who have joined today. This concludes Howard County's press conference, and we thank all who are joining on Facebook and all who are joining. Thank you.